Welcome back, everyone. I hope that was a good time to get a comfort break. I'm really thrilled actually to introduce our next session. So Rosie Bennett is a researcher at the University of Bath and the Royal National Hospital for Rheumatic Disease, and she's a researcher with a particular interest in self-management and in holistic rehabilitation. And the study she's going to talk about is one that NAS has funded, so I'm particularly keen to hear the results of this. So now we'll go straight over to Rosie's presentation.
So thank you for the introduction. Hello everyone, thank you for joining. So as mentioned, my name's Rosie and I'm a researcher from the University of Bath and the Royal National Hospital for Rheumatic Diseases in Bath. Before I actually go into my talk, I firstly want to say a massive thank you to NAS for their ongoing support of this work and for inviting me to speak today as well. The project that I'm actually going to be speaking to you about was initially funded by NAS, so none of this work would have been possible without them. So firstly, a quick introduction about myself. So as I mentioned, I'm a researcher from the University of Bath, where I work very closely with Dr. Raj Sengupta, who's the lead consultant for axial spondyloarthritis, or AXFAR, at the hospital. And we both work within the Bath Spondyloarthritis Research Consortium, which is a multidisciplinary group of individuals and healthcare professionals, both from the university and the hospital, who are working towards developing interventions to help improve the lives of people with AXFAR. So I myself am particularly interested in the use of wearables and self-tracking, self-management technologies in healthcare and research. And as I'm sure you're all aware, digital interventions are really coming to the forefront, both in the recent months and years. I'm also really interested in the links between pain, fatigue, mood, exercise, lifestyle and stress, and the potential for holistic rehabilitation approaches to move towards more personalised preventative medicine. So since joining the university, I've been working on two main projects. So the first, which I'm going to talk to you about today, is assessing the impact of the Bath 2-week rehabilitation course on the natural history of AXFAR. And the second is Project Nightingale, which is a smartphone app for people with AXFAR to monitor daily symptoms and activity. So it's really giving a much more granular insight into the actual daily activities of people with AXFAR. So I'm sure some of you will already be familiar with the Bath residential course, or you might have even been on the Bath course yourselves. But essentially, the overall aim is to teach people the tools they need to self-manage their condition and try to take control of their symptoms. So they're taught by healthcare professionals and experts and taught stretches and exercise to help with their symptoms. They're also taught a bit more about their condition and the different treatments available, and also mindfulness techniques. And again, moving towards a much more personalised treatment approach. And a really unique point of the course is building relationships and meeting others with the condition, which can be really helpful. So an initial overview of the project. Of course, initially we had to define the objectives. So we wanted to assess the impact of the 2-week course on clinical outcomes. So these are some of the outcomes that are routinely collected during clinical practice. So we've got spinal mobility, which is BASME, disease activity, which is BASDI, function, which is BASFE, and also quality of life, such as ASQOL or EQ5D, fatigue, which is FACIT, and work productivity, which is WOPI. So first of all, we decided to focus on spinal mobility, disease activity, and functions. These are the most well-recorded measures. And I needed to initially try and digitize paper records. So as I'm sure some of you may be aware, until very recently, everything was done on paper. So some people had over 30 years worth of paper records that we needed to look through and try and take out any information that would be useful and put this onto an online database to be used for future research. So we now have a research database available, which all the data can be extracted for future analysis using machine learning. And this database includes information on imaging results, laboratory results such as C-reactive protein, medications, and really excitingly, life events as well, which is a really unique point of the database. So, and again, clinical measures as well. So this is just an example of what the database actually looks like and some of the information that we collect. So does the patient have peripheral arthritis, information on HLA-B27 status, and also family history. And again, this is the example of some of the clinical measures. So some of the ones that I haven't already mentioned are the Jenkins Sleep Scale and also the Margolis pain diagrams, which some of you may be familiar with, where you get an image of the body and you have to write whereabouts you're feeling pain. And again, so we record really detailed information on treatment, so even including start and stop dates. And this includes treatments as well, such as high cost drugs, such as Benapali, Enbrel, and Humira. And this is the really exciting bit about the database. So we can actually record information on life events. So information such as accidents, bereavements, divorce, family illness, and periods of intense stress. So we know anecdotally that people can experience a worsening of symptoms during periods of intense stress. However, as this is really difficult to study, to our knowledge, there's currently no work really done in this area, but thank you to this database, we will be able to in future and gain a better understanding. So again, some more variables, referrals, we also record referrals, which could be quite useful. So the database now hosts unique comprehensive data for approximately 1,000 people, including records before and during diagnosis and covering the first presentation of symptoms. As I mentioned previously, some of these records span over 30 years. So there really is unprecedented research potential here, both in terms of gaining a better understanding of the condition and also in terms of gaining real-world data for the impact of treatments. We also have a uniquely well-defined data set for 200 highly engaged patients. So these are people who are using the Project Nightingale app that I mentioned earlier. So every day you're asked how you're feeling, how's your mood, how did you sleep, whether or not you have any fatigue, whether you've taken any anti-inflammatory medication that day. And you can also record optional variables such as menstrual cycle and how that's potentially impacting your mood or your symptoms, and also screen time, smoking and alcohol intake as well. You can also sync the app to your wearable device if you have one, so that it can automatically extract information on steps and sleep. So these are just some screenshots from the Project Nightingale app, so you can see what it looks like. And to the right, you can see these are some of the data outputs. So these can be explored by the users of the app and also with your clinician in clinic. And you can see the different relationships between variables and how they change over time. So we have actually had some people using the app come in and explain to us that it's helped them gain a really much better understanding of their condition and gaining an understanding of what sort of things influence their symptoms. And it's allowed for a level of self-management. So in terms of the results, so spinal mobility appears to improve immediately following the course, and course attendance appears to reduce spinal basmi over time, so improve spinal mobility over time, in addition to reducing the change in spinal mobility over time. In terms of disease activity, again, there was a decrease in disease activity following the course, so an improvement in disease activity. And also of interest, but unrelated to the course, disease activity appears to be increased in people who are female and those with an increased delayed diagnosis. So information such as this is really important because it helps us identify those individuals who may be at risk of poorer outcomes, and therefore they can gain the support that they need in order to have a better quality of life in the long term. So in terms of function, quality of life and work productivity, unfortunately for the BASFE results, we haven't managed to generate any good results yet, but we're looking into this in the future. In terms of ASPOL, which is quality of life, ASPOL appears to improve immediately following the course. And we're again looking into more detailed analyses for quality of life and work productivity in future, which is exciting. In terms of research output, so we've actually, as a direct result of this work, written 3 abstracts so far, exploring relationships between daily symptoms and behaviour in addition to flare profiles. We've actually identified some relationships that haven't yet been explored in AXPAR, for example, between hot flushes and flare and poor sleep and flare. And unfortunately, I don't have time to go into these results in detail with you today, but I will provide the links for that. And hopefully, if you're interested, you can take a look at these and everything. So future work. So as I've mentioned, we are doing more analyses on the course itself. This includes, again, trying to identify individuals who might most benefit from the course and those who may need additional support to try and maintain those long-term outcomes. We're also looking into optimizing course accessibility and always trying to optimize techniques for self-management. We're also looking into exploring in more detail the relationships between symptom patterns and behaviour in order to work out whether there are potentially a chronological pattern of symptoms or behaviour that might lead to, for example, flare or worsening of symptoms, and what the optimal timing of intervention might be to try and improve those symptoms. We're also looking into the potential for integrating self-tracking data into healthcare, which is really exciting. So, for example, a colleague of mine at the university is currently working on designing agenda setting tools to try and support conversations around self-tracking data in clinic. And again, all of this is really moving towards more personalised medicine integrated with research. So thank you all for listening. Are there any questions?
That's wonderful, Rosie. As you said, this is an amazing resource that you have at Bath, to have so many patient records that give you the ability to look longitudinally at patients' life course as a consequence of being on this. And amazing to hear that the results show that the course has a change in metrology and in disease activity. It's really good to have evidence to support why that course is so fundamental to people's lives. So thank you for sharing that. Okay, some questions. Poppy's asking, can we download the Nightingale app?
So currently, if you're actually a patient at the Royal National Hospital for Rheumatic Diseases, you can download the app, but unfortunately it isn't available if you're not a member of the hospital. So if you are with the hospital, you can go on to projectnightingale.org and register your email address, and then you'll be sent a download code and instructions as well about how to download the app on either Android or an Apple device.
Great, we'll try and provide those details afterwards. Wonderful. Has there been any research on the impact of the perimenopause on AS?
Unfortunately, no. To my knowledge, there hasn't been. There has recently been some discussion around potential gender differences in AS, but not so much work on women in particular and on the menopause and menstrual symptoms. So yeah, to my knowledge, this is the first, Project Nightingale is the first study that's actually been looking at menstrual symptoms.
Okay, again, a similar question from Holly. Okay, question from Jane. Are there plans to set up courses around the country or just in Bath?
Yeah, I believe, yeah, I believe there is another course in London, and there as well is so at King's, I think they have, it's not a full week-long course, but you can go in and learn techniques to self-manage. But to my knowledge, that I think they're the only two actually in the country at the moment. So hopefully in future, with improvement in services, they'll be more widely available.
Obviously, there are various outpatient equivalents, but there aren't many comparable to the inpatient Bath course.
Yeah.
Can you track flares on the app?
Yes, you can. So you can track several things, including flares. So flares, pain, mood, fatigue. And essentially the app looks like a flower. So it's a set of petals. And you're asked each day how you're feeling and how each of those symptoms are. So the petals act like the fuller the petal, the better the experience. So if you've got no flare, no pain, the petal will look full. Or if you are experiencing extreme flare or pain, then the petals will be smaller. So yes, you can track flare, and we have actually published recently an abstract on this, looking at relationships between flare and various symptoms. So I can send through some links to that as well if people are interested.
Sounds like there's a huge research program here waiting to develop even further, I suspect. Yeah. If you're going to do any research into stress and AS, how would you record the data and research the data?
So at the moment, it's not very consistently recorded. So that's why it's so important we've built this database. And hopefully, if everyone's entering as much data as possible into the app, and also in appointments, if they're talking about their levels of stress, then we'll be able to record it in the database and on the app. So the app actually records daily stress. So one of the things that we've been looking at initially is how daily patterns of stress. So again, there's five levels that you can record. So 5 would be extremely stressed and 0 would be not stressed at all. And we're looking at how that relates to potentially pain and fatigue and sleep and other variables that are tracked. So if we can see that there are relationships between flare, for example, and stress over time, we can hopefully look to see whether there are certain behaviours that might lead to an increase in stress, or certain things that might be happening that people are entering in their diary that they might learn that is causing them stress as well.
Great, thank you. So a question I know that will interest you is about wearables. Any wearables you would recommend for people with AS?
So I wouldn't myself be able to recommend any specific wearable. I've heard different reviews from different people about what works for them and what doesn't. I think at the moment Fitbit seems to be, from the research in general, it seems to be like it has quite an accurate measure of step count. But yeah, I'm not sure. Sorry, I can't recommend any.
And typically, obviously, NAS wouldn't recommend, but obviously, if any members have got exact experiences they want to share wearables, please do send them through and we'll happily share them. Okay, so some questions about the Bath course. How do I get on and do the Bath course? People will ask this a lot because they hear about it.
Yeah, so in your clinic appointment, you can mention if if you want to attend the Bath course. And then I believe you would then have an appointment actually at the hospital, but obviously there's no face-to-face appointments at the moment. But then you then have an assessment and are booked onto the course. But there's usually quite a big waiting list, and obviously at the moment the course has been suspended, unfortunately, due to COVID. But we are looking at potentially developing an online course, which should be good to make it more accessible. But yeah, we'll have to see.
Okay, so a question about Wales. I know this has come up before, but in Wales there are no longer provisions in place for patients to come across, I believe. Actually, Jill is saying patients from Wales can be treated. Oh, no patients in Wales can be treated in England. Is that your understanding too?
Oh, I'm not sure. Sorry. Yeah.
Maybe can we pull Jill onto the screen? Is that possible, Jill? Are you able to answer that? Are we able to pull Jill Hamilton across?
Hello.
Thank you.
Hi, yeah. So the rules are, this is an NHS England rule. No patients from Wales can be treated in England for anything, not just AS, it's anything, unless it's an emergency. But people who are taken to A&E will be immediately repatriated to Wales as soon as they're well enough to do so. So it's just a general across the board rule, unfortunately, that people from Wales can't be treated in England. Okay.
Thank you very much, Jill. We've had a conversation earlier about inflammation. I don't know. I suspect that this isn't an issue that Bath will be prioritising going forward. Is it really research into inflammatory diets?
No, unfortunately, diets are notoriously hard to study, but there are things such as apps now where you can actually take a picture of your food and it will automatically analyse it. So I think as more technologies like that become available, it will be easier to study diet. But as you mentioned previously, there isn't enough evidence at the moment.
And then finally, two linked questions really about when will the Bath course start again, and given that it isn't running right now, what can people do?
I'm not sure. I can't say. I'm not a healthcare professional myself to say when the course will be running again. But at the moment, yeah, follow the self-management guides online, the advice of Will, and I'm sure as well Zoe later, and everyone in the breakout sessions.
And certainly the conversations I've been having with rheumatologists are about, in the time of lockdown, how can we help patients manage their condition better? What kinds of resources and virtual support? And again, I would say to our members listening and watching today, the new MyAS, My Life set of resources on the NAS website gives you a whole bunch of things to help you with a whole range of areas of living well with your axial SPA. Our time is almost up, and Rosie, it's been a fascinating presentation. The very best of luck with the next stages, really, and I'm sure we'll see good things in times to come. So thank you very much indeed, Rosie.
Thank you.
So we now move to our interactive themed breakout session. So you'll see on the slide here, there are 4 sessions you can choose to go to. And there are separate web links for each of those 4 sessions, which I'm assuming you've already all had in advance. And maybe we can just have those. Let's have a look. They are wonderful. Thank you, Dave. Brilliant. So if you can just, there we go, either close your tab or just paste the link, and then you can go to your breakout session for 15 minutes. And after that, we'll come back at 3:35 and hear from Zoe Clark. So have a good breakout session, everybody.